Today I'll run down the common interventions or techniques in psychodynamic psychotherapy or psychoanalysis, so that if you're a prospective patient or you're an existing patient or client and you're wondering what's going on, now you'll know. This is the 8th video in my playlist on the basics of psychodynamic psychotherapy. Feel free to check out the other videos in this series. I'm Dr. Stephen Reidbord, a longtime psychiatrist and psychiatric educator. If you like what I'm doing here, please like this video and subscribe to More Than Meds. I need to start by emphasizing that this traditional form of psychotherapy isn't really known for its techniques. It's much more about an analytic attitude, as described in this classic book. A way of being in the room, curious and engaged and non-judgmental, receptive, exploratory, and non-directive. It's not technique-y in the way many other schools of psychotherapy are. There are no eye movements or tapping, there's no thought records or homework assignments. So what does happen in psychodynamic psychotherapy? The first technique, so to speak, is to be quiet. We'll get to more active interventions in a minute, but we have to start with staying out of the way. The only way to witness how a client thinks or feels is to give them space to think or feel, to let them do it without injecting too much of the therapist's own personality. The more the therapist talks, the more we learn about the therapist, the less we learn about the patient or client. And this leads to that stereotype of the stone-face, unresponsive therapist, like talking to a brick wall. But, that's a stereotype. It's a caricature. It's not really true. Unlike formal psychoanalysis, where the patient is lying down on an analytic couch and they're meeting several times a week, and the therapist really does say very little in the session, in psychodynamic psychotherapy, it's more of a conversation. Both people are sitting up in chairs, they meet once or twice a week, and you might think of it as psychoanalysis light, a form of psychoanalysis that's closer to a regular conversation. The patient does most of the talking, but clearly not all. So what is it that the therapist does say or do? The classic verbal techniques or maneuvers in psychodynamic psychotherapy fall under 5 categories. The first is what we might call facilitation, which is a fancy word for encouraging the patient to keep on talking. This includes things like the therapist nodding their head or saying, mm-hmm, or please go on, tell me more. In all of these facilitative comments, the therapist isn't adding anything. They're really just saying, I'm here, I'm listening, I hope you'll keep talking. That is mostly what a psychodynamic therapist does. It's not the most meaningful or significant interactions, but it is the most common, simply to indicate to the patient or client that we're here, we're with them, we're listening very carefully, we're devoting 100% attention, and if they can, to please keep talking. The second category is what we can call clarification. And that's when the therapist rephrases back to the patient or client what they just heard. It's a kind of summing up of what they just heard, and it's for a couple different purposes. One is to indicate to the patient that they are in fact listening, they're paying attention. The other is to check out with the patient or client if they heard it correctly, if they actually heard what the person was trying to say. And this is also quite common. It's part of conveying a kind of being with the patient. I hear what you're saying. Did I get that right? Am I understanding this the way that you intend to be telling it to me? Am I interpreting what you're saying correctly? Those are all very common interventions in psychodynamic psychotherapy. The third category is called confrontation. And that sounds like it's picking a fight. It's actually not. Confrontation can be a very mild type of intervention in which a therapist gently points out that the patient has said something that seems to clash with what they said last week, for example. There's a kind of inconsistency or something that could bear further exploration or understanding in the way a patient is talking about their feelings, what's going on with them. It can also draw attention to something that's being consciously avoided. You know, the patient is well aware of the fact that they change the subject every time a certain topic comes up, and the therapist gently confronts them by just pointing that out. I notice you change the subject every time that comes up. That's a kind of confrontation. There are schools of therapy that are much more harshly confrontational, but that's not typical of psychodynamic psychotherapy. The fourth category is called observation, and that is bringing something to the patient's attention that they're not consciously aware of. For example, that they have a certain look on their face every time a particular relative's name is mentioned. They're not consciously trying to have that expression or are consciously trying to change the subject. This is now being brought to their attention, in a certain sense, making it conscious where it wasn't conscious before. There's no attempt with observation to explain what's going on. It's merely pointing it out. And then last but not least is number 5, interpretation. And interpretation is really what Sigmund Freud originally meant by making the unconscious conscious, bringing something to the patient's attention that was previously something they were not aware of or not conscious of, so that they could confront it consciously. And in contrast to observation, this has a kind of explanatory quality. You're having this reaction, or I wonder if you're having this reaction, because interpretation should really be presented tentatively. I wonder if you're having this reaction because you are uncomfortable with this feeling that you haven't acknowledged in yourself. Interpretation also includes linkages. It includes linking together, I wonder if your reaction to your boss at work is similar to those reactions you told me about in your childhood with respect to your parents. That would be not only an observation, but an implied explanation that the person is reacting to their boss as a result of early interactions that they had in childhood. These are the classic verbal techniques or interventions in psychodynamic psychotherapy and psychoanalysis. But we're not purists. Sometimes we'll include cognitive interventions, for example. I'm fond of using a scale of 1 to 10 with some patients who tend to see things in extremes. As we say in psychotherapy, people who employ splitting as a defense. People are all good or all bad, or they had the worst day of their life this past week, or the best day of their life. And I tell them that their feelings and that their life circumstances could be put on a 1 to 10 scale, where 1 is the most awful thing imaginable and 10 is the most wonderful thing imaginable. And then the key point is that most of life occurs between 3 and 7. Very rarely do you face a 1 or a 10 or even a 2 or a 9. And this is a purely cognitive intervention that is helpful in some cases, and patients can then sort of temper how they are viewing their own feelings. Instead of saying this is the worst day of my life, it's a 3 or a 4. In addition, sometimes we'll validate feelings, or we'll do some psychoeducation, a little teaching for the patient or client, and sometimes we'll offer encouragement. None of these are prohibited in psychodynamic psychotherapy, but the point is that those are side dishes, not the main course. The main course, so to speak, is uncovering or insight-oriented work. making the unconscious conscious, as Freud famously said. Which is why interpretation is so emphasized in psychoanalysis. But making the unconscious conscious, and through the use of interpretation, is often uncomfortable. It's uncomfortable for a reason. Patients keep things from their own conscious mind because they're uncomfortable, because they're unacceptable to their conscious mind. And if the purpose of psychodynamic psychotherapy is to bring that into consciousness, there's inevitably going to be some discomfort involved. The question then is, how can the patient look at themselves in this honest but uncomfortable way and face difficult truths about themselves that may be guilt-inducing or shameful? How much do uncovering techniques need to be balanced with supportive interventions that help to strengthen the therapeutic alliance, the bond and connection between the therapist and the patient, so that the patient feels comfortable enough to continue in the work? We don't aim to be cruel, of course, but psychodynamic psychotherapy and psychoanalysis are based on the idea that uncomfortable truths about oneself are kept out of consciousness, or mostly kept out, and that they continue to produce symptoms, anxiety, depression, as long as they persist in that way, until these feelings, often from childhood, can be brought into consciousness so that the person's adult rational mind can look at it. Another angle on technique in psychoanalysis and psychodynamic psychotherapy is that we provide a healing relationship, the doctor-patient relationship. This is a subtle thing because it's not just about being an advocate or a cheerleader. It's not like being a sycophant, like a yes man, in the way that a lot of AI chatbots can be. There are two distinct people in the room, two separate personalities that are interacting in the therapy relationship. They connect despite their inevitable differences. The fact that the therapist isn't a perfect mirror, is fallible, is imperfect, that's actually a feature, not a bug. Because the psychodynamic therapist is largely attuned emotionally, is primarily empathic and interested in the patient, and devoted to understanding the patient's conflicts and struggles, the inevitable small empathic failures and miscommunications become an opportunity for the patient or client to develop resilience and to develop their own sense of self. This is in contrast to gross misattunement or gross miscommunication, which would lead the patient to feel injured emotionally and to raise their defenses. Psychodynamic psychotherapy uses the relationship itself as a central factor in emotional healing. Techniques such as observation and interpretation are important sources of insight, but these occur in a context of a healthy, healing, interpersonal relationship that is safe and trustworthy, even though it's imperfect. This video is part of a playlist on the basics of psychodynamic psychotherapy. There's the playlist. You may be particularly interested in the first video in this series, which talks in a kind of overview about what psychodynamic therapy is. You can take a look at that here. Thanks for your attention. Please like this video and subscribe if you're so inclined, and I'll see you next time.